So next, hi, I'm Samuel. I had my lower left first molar extracted 13 years ago and I'm now 41. The two adjacent teeth have tilted forward and nearly closed the gap. Okay, well, good for you. I'm finding it very difficult to eat because those teeth are touching my upper teeth at odd angles. Is there any way to correct this?
So you said good, right?
We filled the gap, right?
You fill the gap. No, that's not like he's concerned about the tooth filling
Oh.
the gap.
Oh.
So what he's talking about, like what Shai said was like, so when the teeth are, what Shai was thinking, I should say, right? So when the tooth, here we go, there are two teeth, and then there was a tooth in the middle, and when he got the teeth extracted, now these teeth started tilting like this, and then when there was a gap in the meantime, the top tooth started coming down also. So now his bite is completely messed up. So now he's concerned that he's very difficult to eat because those teeth are touching my upper teeth, right?
Right.
So what he's asking is, what can be done to fix the problem? So what needs to happen is, now these two teeth are tilted, the bottom teeth, so that need to be put back, and then the top tooth is coming down, that need to be pushed down. So a lot of times if it is not completely tilted down, then we can still use the gap that we have to place an implant at the bottom, and then we can simply shave down. Depending on, if it is not too far down, then we can simply shave the upper tooth down and then put an implant to completely fix your bite. When it is too far tilted down, or when the top tooth has come too far down and we still able to help you fix your bite, that's not a problem at all. We can simply use braces to push those teeth back on, create the space in between, and then same thing, the top tooth, once it comes down, we can use braces to push the top tooth like upwards and then create the space and fix it, all of that. So anything is possible. So talk to your dentist and they should be able to help you. Talk to your implant specialist, they should be able to help you. Happen to be in the Dallas-Fort Worth area, come see us. Who can help?
We can.
There we go. You got it.
Absolutely.
Yeah.